Good day, wherever you are. I am Jean-Paul Turaishimye, and you are on East African Daily Update. I would like to welcome you on this English program. Today's date is November 16th, 2022. As I was reading on Twitter, I did come across a letter by one Nyanja Brodin. She is Swedish, a Swedish national, who did try to invest in African healthcare system in Africa, in Rwanda to be specific. And in this letter, she will expose, or she is exposing hypocrisy by President Kagame and Rwandan government. What they say that they are for investors or foreign investors is just not true. To be fair, or to be honest, I don't think this was just another human being who was fooled by sweet talks, sweet words by President Paul Kagame. So Nyanja was fooled because of some speeches that Kagame has made that lured her or that attracted her into investing in Africa or investing in Rwanda. You know, Rwanda and Paul Kagame, they like to portray themselves as the best in doing business in Africa. That is a status they sometimes earned by foreign polling or foreign media, because not really because of what they do, but what they say. Because how Kagame portrays himself to the international community. So the letter you're about to hear details how experts in medical fields in Rwanda, these are Rwandans, believed in this lady's project or in Nyanja Brodin's project. Those experts are the former Minister of Health, Dr. Richard Sezibera, and also another doctor, medical doctor, Dr. Emmanuel Ndahiro. Ndahiro was once an advisor to President Kagame and also ended up becoming the head of National Intelligence Security Services in Rwanda. And I believe when Nyanja Brodin was trying to do business in Rwanda, Dr. Emmanuel Ndahiro was the head of Rwanda Military Hospital, also known as KMH, Kanombe Military Hospital. So you would think that a project such as this, especially since it focuses on children's health, I'm saying that it focuses on children's health, but you have not had the opportunity to hear about this project. But you're about to in a few seconds when Angie is going to read the letter to us. So this is a project that that was supposed to deal with healthcare for children or referrals something. So Rwanda, as an underdeveloped country, you would think that she would jump at this opportunity. But as this letter by Brodin Nyanja details, so in order to succeed doing business in Rwanda, you will need someone powerful. But it's not just anybody. Who is powerful in Rwanda? Who is powerful in Rwanda? It's pretty much nobody. It's only President Kagame or Paul Kagame and his family. Just the first family. If you don't go through them, it is pretty much impossible to have to conduct business in Rwanda. You may succeed for some times, but it's not going to last. What it means is Paul Kagame and his family, They must be shareholders in your business. That is what Nyanja Brodin did not understand. That was the message. You have to involve them. You have to include them. They have to be shareholders. And in the end, they're going to take your business. They're going to steal your business. You have no business. You start as a majority shareholder and you end up as a minority or maybe working for them. That is why a Rwandan tycoon, Ayabatwa Tribert Rujugiro, does no longer do business in Rwanda and actually has fled the country. He has business almost in maybe a third of African countries. Maybe that is exaggeration, a little bit of exaggeration. But he has business in a lot of countries in Africa, but not in Rwanda. Despite that, he once was a member or a cadre of the RPF, Kagame's political party. He did fund them for a while. So you would think that he'll be doing business in Rwanda, but no. So it's just, that is, Rujugiro will be a good example. Anyone who knows his story will definitely rethink or think twice their decision to go do business in Rwanda. That is why a prominent businessman, Rwigara Paul, was assassinated. And his business, listen, Rwigara, let's put politics aside. So assuming that he died by car accident, as the government of Rwanda tried to tell the story. The government's own story is that the businessman died in car accident. Everyone knows that that is not true. Definitely not true. He was killed. He was assassinated. But let us believe in government of Rwanda's story for 2 seconds. So Rwigara was a prominent businessman. He had multiple businesses in Rwanda. That is actually the case for Ayabatwa Tribert Rujugiro. So why didn't Rwigara's business survived? Why Rwigara's children can't run the business of a man who died by a car accident, if you believe Rwanda's story? Of course, Rwigara's story is in the media. Everyone knows about it. But that was the Rwandan version of the story, that he died with car accident. Therefore, Rwandan government is not to blame. But even if you believe that, even if you believe Rwanda's story about Rwigara's death, then you should ask your question. You should ask yourself a question. Why isn't Rwigara business working? What happened to it? So the answer is in lawsuits by the government of Rwanda trying to take away this business from Rwigara's family. And these lawsuits are in Rwanda. And I hope one day, maybe, just maybe, or I hope Rwigara's family can sue Rwanda in East African Community Court of Laws. I think they have one in Uganda, another one maybe in Arusha. I don't know. Maybe one in Arusha. Because this will expose more the government of Rwanda lies. So the list is endless. I will not bother mentioning the list of businessmen who were killed or robbed of their businesses, because that's what they do. That's what the government of Rwanda does. So what is the lesson in all this Nyanja letter, Brodin's letter? Please do your research. Talk to Rwandans. And don't get fooled by Kagame's sweet talks. So I'll let you hear for yourself what Nyanja's Brodin experience in Rwanda in this letter, and Ange is going to read the letter for us. Please be patient. It's a brief letter, but it has the details. You don't want to miss this. Ange?
Dear Mr. President Paul Kagame, say no, fight back, you said. You should do what you know is right for you and your country. You also said, I dreamed that someone would have the courage to come to me, saying that they were doing the right thing, only to face an official bringing all their power to sabotage. Then I would show them what I would do. Umushyikirano, 2018. I watched your speech, and I armed myself with these words, but in the end, they were not enough. Even though your words were probably honest and true, your government failed to live up to them. Today, following your advice and doing the right thing in Rwanda has put me and those associated with me in danger. Before launching our project, I traveled around the country in 2016 and met as many locals as possible to learn of ongoing developments and how to best implement our ideas. We realized that our projects would only work if done in close partnership with the government to ensure durable improvements long-term and efficient integration with the national healthcare system. Personally, I am not a medical expert, but I am surrounded by brilliant doctors and scientists, including my husband, a professor and pediatrician. It was evident that Rwanda had made good progress in providing basic health care to all but lacked any advanced care for referrals. Well-to-do individuals travel abroad for safe deliveries and advanced care. We formulated ideas to develop such advanced care in Rwanda, especially for children, given the very young population in the country. We knew the value of data, and my husband predicted that health data would soon be the next resource extracted from Africa unless governments recognized its value and took control of data collection and learned how to utilize their health data. We proposed to build on advances made in IT infrastructure, the new ID number system, and build capacity for Rwandan health data collection and analysis within the country. We envision a centralized diagnostic center where health data and biosamples would be analyzed using state-of-the-art instrumentation and integrated with registry data. Rich data sets and sample repositories would hold immense value, be owned by the government, and could guide smart public health policies, but also bring income through partnerships with pharma, biotech, and academic partners. My husband and his colleagues have all the knowledge to make this happen. We also propose to establish a first tertiary referral hospital for children for the East African region where cases currently not manageable could receive care. The center would serve as a subspecialist training center with senior physicians from Sweden and other countries volunteering as mentors. Collectively, these programs would place Rwanda in a leadership position in the region and propel the country towards a knowledge-based economy, as you have often envisioned and spoken about. We wanted to take a different approach from other existing organizations working in global health, relying on volunteers as experts, no salaries, and no organizational overhead, such that all raised funds would be used for program expenses alone. We knew there would be challenges to overcome and even mountains to climb, but we wanted to tackle one little hill at a time, and hence we called the organization Little Hills. In March 2017, Ambassador C. Nkurikinka asked for Minister of Health Diane Gashumba to visit the Karolinska University Hospital in Sweden, and my husband hosted them together, embassy staff. We described our ideas to Minister Gashumba. Subsequently, we met the minister again in Rwanda, reminded her of our ambitious projects. The minister did not fully grasp the projects and tried to steer us towards her own ideas and agenda involving sports and wellness rather than advanced referral care. In December of 2017, at Umushyikirano, I met then Senator Dr. Richard Sezibera, and soon my husband presented our ideas to him. Dr. Sezibera called these ideas music to the ear. He provided valuable advice which reinvigorated the work. In September 2018, journalist Berna Namata introduced me to Dr. Emmanuel Ndahiro, the previous head of the military office in Kigali. Dr. Ndahiro also immediately understood the potential of our ideas and had many important suggestions and invited Dr. Angelique Guillereka to join. Together, we visited the presidential office, ministries of health and finance, senior leaders of RPF, the Rwanda Development Board, University of Rwanda. Our organization, Little Hills, gained momentum. Although our partnership with Dr. Ndahiro and Guillereka was important, we also had our differences. We were told repeatedly not to protest or object, but had to work with the minister and adapt to her way of working. We continued to refuse and fight back, but inevitably, our project stalled. After 6 months, these differences were insurmountable, and we parted ways. In hindsight, this setback should have led me to give up in Rwanda, but since everyone who understood the ideas expressed strong support and we had gathered a fantastic team of experts in Rwanda, Sweden, and USA, I decided to continue. In 2020, I lost my 42-year-old sister to COVID-19 in Rwanda. In despair, I addressed you directly on Twitter to alert you to the mismanagements and lack of accountability. Following this tweet, I was personally threatened and intimidated. I was told you were infuriated and that important people in the inner circle were angry with me and that my tweet would now jeopardize myself, but also Little Hills' projects. Since my mission of bringing people together was accomplished, I resigned from the boards of Little Hills, Sweden, and Rwanda in September 2020, as not to distract or negatively impact the work. COVID-19 also halted some of our ongoing Little Hills volunteer programs in Rwanda, but leading pediatrician experts continue to meet virtually and consult Rwandan colleagues on challenging cases. A network of interactions between individuals was taking shape. A delegation of 12 senior experts from Sweden and USA had planned to come to Rwanda in October 2022 to reignite the capacity-building efforts in Rwanda. On September 9th, the director of Astrid Lindgren Children's Hospital, where my husband is an employee, called following an interaction with Rwandan embassy officials in preparation for a visit of your wife, the First Lady of Rwanda. The previous Minister of Health, Diane Gashumba, fired by you for mismanagement, is now the ambassador of Rwanda to Sweden, and together with Rwandan diaspora member Eugene Mushayija, embarrassed herself and the government she represents by pretending to be unaware of Little Hills' work, despite years of discussing it, meeting several of its senior physicians, and even personally signing a memorandum of understanding with the same organization. The head of Astrid Lindgren Children's Hospital immediately recognized the political games being played and signaled directly to my husband to alert the Little Hills organization and its professionals and experts involved in Rwanda. This episode illustrates the complete lack of umuco that is hampering development in Rwanda, and which you have addressed in many of your speeches over the years. The Little Hills volunteers and senior physicians interpreted this act as a clear signal that Little Hills is no longer welcome in Rwanda, and the organization has canceled its upcoming trips, 4 of senior pediatricians and experts to the country. Little Hills also suspended its additional programs, including the fundraising for a children's hospital. Bad Umucho has been the subject of many of your speeches, illustrating that this is a well-known phenomenon, not the action of a single official. But why is there no accountability for wrongdoing, mismanagement, and lack of professionalism? Now I am told that everyone associated with me or the Little Hills Project fear repercussions in Rwanda because of my tweets. Is it reasonable that my truth, written on social media, is worse than the lies of a minister that, in your words, put the lives of Rwandans in danger during the pandemic? I personally take full responsibility for involving this network of brilliant physicians, experts, donors, friends, and family members. I am very sorry to have dragged good people into this, but I am also incredibly proud of all the accomplishments of Little Hills in forming a powerful team of experts, raising funds, and performing a feasibility study for a first referral children's hospital, initiating a scholarship program, and establishing a knowledge-sharing program for pediatrics specialists. Many amazing people responded to my requests to contribute and were willing to work hard without any compensation for the development of Rwandan healthcare and for the children. To everyone in Rwanda who volunteered their time and did everything they could to help the Little Hills Project, thank you for showing that Rwanda does work sometimes and that good people are powerful. And to my family members, friends, and strangers who believed in doing things out of kindness and who consistently supported me, I am truly sorry that your efforts were not welcomed in Rwanda. Mr. President, you have spoken clearly of the challenges and the lack of a professionalism in Rwanda, but you also promised to establish a system that protects young people like me trying to contribute. Unfortunately, you have now failed me. There is no protection for me. Many have told me that I lack prerequisites for success in the Rwandan society, such as an influential family and a RPF membership. All the hardship I have endured in my life has shaped me into who I am today. I am proud of this person, and I am unwilling to conform and submit, even if this makes my life more difficult. I came to my mother's land at my own free will. I have never asked for anything, and I never received anything from the country. I was privileged to be educated and surrounded by brilliant people that were willing to contribute to my country. Now I have lost my mother. My children have lost their grandmother. I've lost my birth country, to which I no longer feel safe to return.